national Gallup poll shows nearly half of Americans are now worried they won't be able to afford coverage next year. And this comes as some Affordable Care Act tax credits are set to expire.
Now in Jacksonville, one free clinic says that it's seen the worry and the concern firsthand. Our Free Hopper joins us now, and you had a chance to speak with the CEO of Volunteers in Medicine about some of the barriers that folks are facing.
Yeah, according to experts and leaders at Volunteers in Medicine these days, the problem most Americans face isn't a lack of insurance, it's underinsurance. People are showing up to doctor visits unable to cover copay costs, and they're also dealing with higher premiums and expensive prescriptions.
It makes no sense that we are one of the most developed countries in the world and that people are dying because they don't have the basic care.
Volunteers in Medicine, a free clinic in Jacksonville for the working uninsured, says it's seeing more people than ever who can't keep up with rising healthcare costs.
We're seeing people calling us in desperation. They can no longer afford their medicine.
Myra Martello, one of those feeling the impacts, says she's postponing retirement to afford medications for diabetes and high blood pressure.
But I went from paying $1,200 a month to now $1,600 a month for next year, which is outrageous. Basically, I go for my primary care routine visits.
One of the reasons for the higher premiums, Affordable Care Act credits set to expire in 2026 for millions of Americans as Congress debates the ongoing issue on Capitol Hill.
Probably about 40% of our population, they're making around $50,000 for one individual, and they're living paycheck to paycheck. They're trying to pay their rent. They're trying to stay in their home. They're trying to provide childcare for their children.
Health experts say since people can't afford it, they're delaying care.
Instead of, having health insurance, going to the doctor once a year, getting all of the vital screenings that you need, people are saying, I'm not going to have health insurance and I'm just going to wait till something happens. And that's not a way to live. People are showing up sicker and they're going to the emergency room, and the emergency room is then sending them to us so they can have a primary care doctor, but they're really, really sick.
As a result of postponing regular doctor visits, unexpected visits can be financially devastating.
One of the things that I do is I write stories about medical debt. So every day I'm hearing people that having an insurance have to go in bankruptcy because they had an emergency visit and you don't have control or even having an insurance. People that say, do not take me to the emergency room unless they're fainted, and somebody has to make that decision for them.
Leaders from Volunteers in Medicine urge you to get screened early, better understand your healthcare coverage if you have it, and reach out to professionals before your health takes a turn. Heather, Anthony.